Hello, welcome back to the Health Center channel. My name is Kezia. Today we are continuing on our second series of the topic dengue fever. We have already discussed what the dengue fever is, where it occurs, the signs and symptoms. Today we are going to look at three more things. What to do when you've got the dengue fever, treatment available for the dengue fever, and preventive measures to take for the dengue fever. So let's dive in. What do you do when you suspect you've got a dengue fever? The first thing you want to do is to contact your doctor so that you are very sure. If you have traveled to a dengue fever endemic region, please make them know where you've been so that they'll take your travel history and your medical history. Now, this is what the protocol is for UK. According to the NHS, if you have traveled to a country where dengue fever is endemic and you are back and you start getting any of the signs and symptoms, immediately arrange for an emergency GP appointment or call the NHS 111 for advice. Whoever you speak to, please tell the person about your traveling history. If you are experiencing severe dengue symptoms, such as unable to stop vomiting, restlessness, pale skin, and rapid breathing, call 999 for an ambulance or go to an A&E straight away. But it is not advisable to drive to the A&E by yourself. Get someone to drive you so that you can get treatment as soon as possible. Now, what is the treatment for the dengue fever? Unfortunately, there is no specific medication for the dengue fever. Not yet. But we have what clinicians call symptomatic treatments or supportive therapy. So they treat it according to the symptoms you present. There's always high fever, so people can take paracetamol to lower the temperature and to deal with the muscle pain that comes along with the dengue fever. However, do not take ibuprofen or any non-steroidal anti-inflammatory drugs as they increases your chances of bleeding and making your symptoms worse. Because there is temperature and there is vomiting and cases of diarrhea as well, you want to increase your fluid intake. So people who get severe dengue and end up in the hospital may end up getting fluid therapy. So what are the preventive measures? For those living in endemic countries, areas where the mosquito are really endemic, the main thing that the World Health Organization is advocating for is the source elimination. That is getting rid of the mosquito as much as possible. Now, the mosquito that spreads the dengue fever usually breeds in stagnant water areas and they live closer to human habitats. So, if we try to get rid of empty bottles, cans, unused ties, which have got stagnant water in them, then the mosquitoes have less chances of breeding around us and causing the infection. Items for collecting and storing water should be properly covered to prevent mosquito from breeding on them. The use of insecticide treated nets. Be sure to sleep in the insecticide treated net every night. Use of mosquito coils, as these are prepared to reduce the mosquito population. Use of mosquito repellent creams or spray, but it is advisable to have one that contains the active ingredient DEET, DEET, or depicaridin, as this is very effective. When you step out, especially in the morning or just in the evening, just before dusk, be sure to dress properly to cover your arms and your legs. Window screens should be put in place and doors tightly shut to prevent the mosquitoes coming inside all the time. Now, these are the things you can do individually to reduce the breed of mosquitoes and reduce your chances of getting into contact with the mosquito. There is an approved vaccine for the dengue fever for both travelers and those who live in dengue fever endemic countries. Please make good use of that to reduce your chances of getting the dengue fever. So today we have learned a lot, isn't it? We've identified what to do if we have the signs and symptoms of the dengue fever. We know the treatment available and we know what we could do to prevent the dengue fever. So in our next video, we're going to talk about the pathophysiology of the dengue fever virus, exactly how it goes about when it enters your body. And then we will learn all that there is about the vaccine available, the name, who qualifies for it, what are the characteristics involved. So please stay tuned. If you are excited to know more, come back to the Health Center channel and then you get all that there is to know about it. Until then, stay safe and see you soon.